my job is to, without further ado, is to switch the screen to today's presentation. I'm gonna put something in the chat group here. There's two handouts that Mended Hearts did, which I looked at, that are quite small, that cover the topics that the two presenters are going to cover. So if you're interested in digging into more information, the URL is going to be at the bottom of the chat bot right there. But so I'm going to switch screens and start the presentation. And
good afternoon, everybody, and welcome to the webinar. Today we are in our final session of our Beyond the Numbers 2021 series. This has been a fabulous series, and we're so excited to finish off with this wonderful topic: dietary supplements and cardiovascular health. And this is Lipid Mythbusters. So this is going to be an exciting one for us all to learn. Before we get started, I just wanted to take a moment and introduce the organizations who we have worked together to partner in bringing this amazing session series to you. Mended Hearts' mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. The National Lipids Association's mission is to enhance the practice of lipid management in clinical medicine. And the foundation of the NLA's mission is to improve the welfare of patients and families affected by cholesterol and triglyceride problems. It has been a joy to work together with the NLA and the foundation of the NLA to put this series together for you all. Before we begin, I just want to make a note that all attendees are in listen-only mode. If you cannot hear, please check the audio button on your personal computer to assure the sound is on. Please type your questions into the Q&A box at any time during the presentation, and questions will be read after the presentation. Just as a note, the presenter will not be able to answer questions specifically about you or your loved one, as she is not your treating physician. And finally, the PDF version of the slides, as well as the recording of this presentation, will be available on the Mended Hearts website following the event. So now I'd like to introduce to you our amazing presenter that we have with us today, Geeta Sikand. She is the Director of Nutrition and Preventive Cardiology Program, Associate Clinical Professor of Medicine, the Cardiology Division, University of California, Irvine School of Medicine in Irvine, California. And Geeta, thank you so very much for being here with us today. It's a privilege to have you. But before we get started and I turn it over to her, I would like to do a quiz, as we've been doing all series, just to test your knowledge on what we're going to be learning today. So I'm going to launch this first poll. And the question is, does CoQ10 improve blood sugar regulation? If you don't know the answer, just take a guess. Maybe you don't even know what CoQ10 is, but we're going to learn today. And we just like to see what we're looking at. So we're going to just take one moment here until everybody gets a decent amount of people voted. And then I will show the results. Another 5 or 6 seconds if you can vote. All right, we're going to share results. And here's what we've got. So 62% say no, and 16% say unsure of what CoQ10 is. So we are going to find out. So I'm going to go ahead and turn it over to you, Dr. Sikand.
Thank you for the kind introduction, Andrea. I'm really pleased to be here today to speak on one of my favorite topics. I would especially like to thank the organizers of this program, because it's wonderful that you're bringing this to the public. Okay, so I have no disclosures. Okay, so I would be remiss if I did not start out with this slide. And this slide is about the 2 key lifestyle factors that prevent heart disease. So before we jump into the domain of supplements, let's first get our facts straight that there are two lifestyle factors that we must first work with, and then we supplement, just like the name says. So focus on heart-healthy dietary patterns, which means increasing proportion of plant foods, which are rich sources of vitamins and minerals. Emphasize vegetables, fruits, whole grains, lean animal or plant proteins, non-fat dairy, unsalted nuts and seeds, and heart-healthy oils. Secondly, regular physical activity, which includes about 150 minutes per week at least. And again, there is a linear relationship. The more activity you do, the greater the benefit. And also to include resistance exercises and strength training. So moving forward, our topics of discussion today will be, we will define dietary supplements. I've divided the talk into two sections. The first section, we will examine evidence-based dietary supplements that may have lipid-lowering or cardiovascular benefits. And in the second section, we will discuss the evidence about whether vitamins and mineral supplementation reduces heart disease risk. And there are two recent papers that I will be covering there. So if you conduct a search for lipid-lowering supplements, here's what you will find. 600 results. And as we know, lipid-lowering supplements are not intended to replace your medications, but some may help to reduce your cholesterol, especially in those with mild to moderately high levels, or those who cannot tolerate statins, or patients on medications, but not at an ideal LDL cholesterol level, which is the bad cholesterol. I want to mention here that 1 in 10,000 people may get muscle pain from statin, and we will discuss this further as we move forward. So some lipid myths we will discuss today are whether Reddy's rice is a healthier alternative to statins for those who never had a heart attack. Is CoQ10, does it improve blood sugar regulation? And the other two are about EPA or fish oil supplements found on the shelves. Are they same as the prescription EPA or fish oil? And again, whether calcification in arteries is caused by calcium supplements and whether we should take it or not. So just as a background, dietary supplements are a $40 billion industry with 80,000 products. And sadly, they're not required to demonstrate efficacy or safety. But we can go to some resources such as Natural Medicine's database to look up the safety of these products. The other thing is, when it comes to supplements, you want to be supervised as a patient by your doctor, your nurse practitioner, your PA, whoever is your provider at the time, and also your dietitian. And it is very important to include supplements in your medication record. There are independent testing places that we can turn to. And also the FDA is going to do some proposed changes, which they did back in 2019, and they're working on those. For example, to ensure safety, they are going to look at a rapid response tool that can be used so that people can know immediately if there is a danger to a particular dietary supplement. So they're going to create the Botanical Safety Consortium, which will evaluate the safety of botanical ingredients and mixtures. So the definition. So dietary supplement is defined as something that comes in a pill, capsule, or extract form from a food source to improve health and to prevent or treat a medical condition or a disease. So examples are fish oil capsules or vitamin pills. So as we move forward, I want to share with you a recent study that was published on CoQ10, because remember, that's the one on your test, post-test, you'll be asked again. So the main finding of this study in patients who have statin-induced myopathy or muscle pain is that CoQ10 supplementation resulted in improvement in statin-associated muscle symptoms. And they examined a number of studies before they came up with this finding. So in statin-intolerant patients or muscle aches being experienced by the patient, CoQ10 can be considered because statin intolerance is not a reason to stop taking it. It is a reason to consider taking CoQ10 supplementation. So why are dietary supplements important? Well, as we said, they're not intended to replace your prescription medications, but they may help achieve treatment targets. So in this section 1, we will examine supplements that can be used for reducing your bad cholesterol or LDL cholesterol. And these are your plant sterols and stanols, viscous fiber, red yeast rice, berberine, bergamot, garlic, green tea extracts. I especially chose these because in a recent review article, they examined all of these and they rated the evidence as grade 1 or grade 2, and they also divided the evidence into 2A and 2B. And when they did that, they found that there were 2 that were definitely could be recommended, and those were red yeast rice and berberine. The others, they said, must be considered with your provider and then come to a decision. So let's examine all of those today. The selected evidence based on these supplements that we will discuss today, we wonder what is the mechanism of action. So here it is. These supplements may prevent absorption of cholesterol from the intestines. For example, the plant sterols. They may prevent production of cholesterol in the liver, and the plant sterols could do that as well. They may remove LDL cholesterol from the circulation, and we'll look at that. And many have multiple or unclear mechanisms of action. So the first one we're looking at is plant sterols and stanols. As I said earlier, they reduce the absorption of dietary cholesterol, and they also reduce production of cholesterol from the liver. So the good news is that the 2015 National Lipid Association dietary recommendations recommended plant sterols and stanols as supplements. And here we can see that if we were on a standard American diet, which is called the SAD diet, which is not high in fruits, vegetables, legumes, we would have only 200 to 400 milligrams per day of plant sterols. But if we are on a plant-based diet, we could get up to 800 milligrams. But guess what? We need 2 to 3 grams per day for 8 to 12% LDL cholesterol reduction. So to get that much, we do need to work with a supplement. And again, it is safe to use, but it should not be taken if you have a rare genetic disorder called cytosterolemia. And your provider who's monitoring you will definitely know if you have that. Okay, so the next one we're going to review is viscous fiber. And this also is recommended by the National Lipid Association dietary recommendations. And in this, we can see that it traps cholesterol in the intestines and reduces its absorption. So what are some good food sources? Well, oats. Remember, eat your bowl of oatmeal every day. Very good data to support that. And also barley, beans, lentils, even fruits, apples, pears, citrus fruits, your vegetables. But supplements can also be taken, and supplements usually come as psyllium husk, pectin, or guar gum. So dosing is about 5 to 10 grams per day to reduce LDL by 5 to 11 milligrams per deciliter. It is safe to use. We start out at 5 to 10, and if tolerated, we can go up to 20. But we do recommend a lot of water when you increase your fiber intake. And there is a chance for occasional mild stomach upset. Now, red yeast rice, that's one of those that had the grade 1 recommendation, does reduce LDL cholesterol. This particular study was done in 5,000 participants in China, and they'd had a previous history of a heart attack. And in this population, their LDL cholesterol, after taking red yeast rice for 5 years almost, reduced 17.6%, and HDL increased, and death rate decreased from heart disease by 30%. And there's the dosing, but definitely have a conversation with your provider to see if you are an appropriate candidate for it or not. And it is safe, usually well tolerated, but the problem, and this is where I say caution, is there could be a high variability between products, as well as inconsistencies between label and actual contents. So be wary of that. Berberine. And berberine is the other one that got a grade 1 recommendation. Berberine, you can see in this pretty picture, there's such pretty berries. They reduce production of LDL cholesterol, and they are found generally in the plant roots, rhizomes, and stem barks. The meta-analysis, which means it is a study which included many other clinical studies. So in this one, there was 27 clinical studies, over 2,500 subjects or patients, and they reduced their LDL cholesterol by 25 milligrams per deciliter. It reduced blood sugar and triglycerides. And so there was a nice additive reduction in LDL cholesterol, total cholesterol, and triglycerides in combination with statin therapy. So they can be useful, berberine supplements, in statin intolerant patients and those with mild high LDL cholesterol or metabolic syndrome. And the dosing you can see here, 500 to 1,500 could lead to 15 to 20% LDL cholesterol reduction. Safe, well tolerated, but there could be occasional mild stomach upset. Bergamot. This is that bitter citrus fruit. As you can see in the picture, on the inside, it looks like a lemon, but the outer surface you can see is kind of rough. So bitter citrus fruit, which is bergamot, decreases production of LDL cholesterol, and it is extracted from the peel of the bergamot plant. So in 2013, there was a study with 77 patients on rosuvastatin and plus 1,000 milligrams of bergamot. And guess what? They had a similar LDL reduction as those that had rosuvastatin 20 milligrams. So this was a pretty exciting study. It also reduces triglycerides and increases the good cholesterol. And you can see here the dosing, 500 to 1,500 milligrams per day leads to 15 to 25% LDL cholesterol reduction. But again, although it's safe, there are minimal side effects such as mild heartburn. Artichoke leaf extract. Now, this is the one that got a 2A, which means there are randomized controlled studies, but not enough studies to say recommended. So considered, like it can be considered with your provider. So the mechanism is it decreases LDL cholesterol production. There was a meta-analysis of 9 randomized controlled trials with 700 plus patients, and it lowered LDL by 15 points. And the higher the LDL, the better the response. And the dosing is about 1 to 3 grams per day for a 5 to 15% LDL cholesterol reduction. And it appears safe, but occasional minor stomach upset. Garlic, it prevents production of LDL cholesterol. 39 randomized controlled studies. And randomized controlled studies are studies in which you have a control group and an intervention group. So they're really the gold standard. Lowered LDL by 9 milligrams per deciliter. But they did find that raw garlic did not have a good effect. No positive outcome in this particular study. So they do recommend the aged garlic extract because that was the most effective, 5 to 6 grams per day for 5 to 10% LDL cholesterol reduction. As far as safety, it's okay, but caution with aftertaste because of the high dose. Green tea extracts. I know many of you drink green tea and you're wondering if that's helping you. So green tea extracts also reduce absorption of cholesterol and production of cholesterol. A meta-analysis of 20 randomized controlled studies showed a 7 milligram per deciliter LDL cholesterol reduction. Greater cholesterol reduction was noted with longer duration. So about 500 milligrams of the green tea extract twice a day was giving about 5% LDL cholesterol reduction. But if you drink green tea, it would take 60 to 100 ounces per day of brewed green tea to get that effect. And the problem with that would be that you would then develop iron and folate deficiency. So I wouldn't depend on green tea for your green tea extract. I would depend on green tea extract itself. Okay, so here's a quick summary of the LDL cholesterol lowering supplements we just discussed. Red yeast rice, berberine, plant sterol, stanols, viscous fiber, bergamot, artichoke leaf extract, garlic extract, and green tea extract. So in these, you can see in the middle column the dosing, and in the last column, you can see the percentage of LDL cholesterol reduction. Okay, so in concluding section 1, appropriate dietary supplements have additive effects due to the multiple mechanisms, including when combined with diet and medications, such as statins, have potential for a lower dose of statin, have other positive effects, such as they can reduce artery stiffness, improve artery health, and reduce inflammation. And they appear to be well tolerated, safe, and effective for statin intolerant patients. However, they must be done in conjunction first, that statin is given with CoQ10. And if that doesn't work, then this may also be considered in addition. Okay, now we'll go to section 2, which is the effects of vitamins and mineral supplements on heart disease risk. So as I mentioned earlier, 2 recent papers, one was in 2018 by Dr. Jenkins in Toronto, and the second one was a vitamin D calcium supplements and implications for cardiovascular risk paper by Dr. Mikos in the just this year, 2021. Okay, so let's see what Dr. Jenkins reported from his systematic review and meta-analysis. So they looked at all the studies published from 2012, and here's what they found. They found preventive benefits were reported, but low or moderate evidence. For folic acid, it reduced overall heart disease, and folic acid with B vitamins also reduced stroke risk. But no effect on dietary heart disease in a prevention was noted from multivitamins, vitamin C, vitamin D, beta carotene, calcium, and selenium. There was an increased risk for overall death from antioxidants. You know, those are the beta carotenes and so forth, and also from niacin. So they concluded that conclusive evidence for the benefit of any vitamin or mineral supplement, all of them was not demonstrated. Therefore, any benefit seen must be balanced against possible risks. Okay, so this slide looks very complicated, but it's not. I just want to share with you the section C, which is the left corner. And this one shows significant effects for cardiovascular disease events in vitamins and minerals. And this showed very nice outcomes for stroke with folic acid. You can see a 20% reduction in stroke. And it also shows 18% reduction in total cardiovascular disease or heart disease from folic acid. And when folic acid was part of a B complex vitamin, it still showed a 10% reduction, meaning that there was less amount of folic acid in the B complex or a multivitamin. Moving forward, if you look at the D section, significant effects for all-cause mortality in vitamins and minerals, you can see it actually went up significantly. It was about 5% with antioxidants, and with niacin also it was about 8%. So the upper two I'm not going to go into because these are non-significant effects. Okay, moving forward, now we'll go to the MECOS paper conclusion. The MECOS paper, which was just published this year, concluded that low blood levels of vitamin D were associated with high risk of heart disease in observational studies. So if the vitamin D levels were low in populations where they just studied what happened to them, they found a higher risk for heart disease. But when they conducted randomized controlled trials, whereas we know that they would have a control group, they found that the vitamin D supplements did not reduce risk of heart disease. Then they looked at calcium supplementation, and there was some bad news. Increased risk for heart disease was reported with calcium supplementation in some studies. But the good news is that calcium from food sources instead of supplements is preferred. And here's a continuation of the conclusion that based on randomized controlled trials, calcium supplements were also linked to an increased risk for kidney stones and colon polyps. And the colon polyps were likely due to the constipation that is associated with calcium supplementation. Therefore, calcium supplements are not without risk for other adverse side effects. So what are some recommendations? Well, we go to the patient-provider discussion always and supervision by the provider. Persons at risk for osteoporosis, moderate calcium intake, which is 1,000 to 1,200 milligrams per day, plus vitamin D, can reduce the risk for fractures. So consider it when intake is not achieved from food. Secondly, there is potential for harm with calcium supplements, especially at higher doses, greater than 1,200 milligrams per day. And the benefit to risk ratio should be carefully considered. Finally, some patients may benefit from calcium supplementation, but they may still be exposed to a potentially slightly elevated risk for cardiovascular disease events. So that's why we go back to that patient-provider discussion. So in summary, when it comes to vitamins and mineral supplements, folic acid, which is one of the B vitamins, was beneficial in the prevention of stroke. However, calcium supplements, especially at higher doses, may cause harm. So when you take your post-test, I wanted to give you the answer. So this is your cheat sheet. Reddish rice is a healthier alternative to statins for those who have never had a heart attack? No, because the study I presented to you was in patients who had had a previous heart attack. So we don't have studies on patients who've never had a heart attack. CoQ10 improves blood sugar regulation? No, it has nothing to do with blood sugar. It's an antioxidant. So, now you know what CoQ10 is. It's an antioxidant. And then to the third one, where you are prescribed a prescription EPA and your copay is $60. Can you just trade it off for a fish oil supplement from the supermarket or drugstore? No way. They don't have the same efficacy. And those with calcification in arteries shouldn't take calcium supplements. You know the answer. I put down there depends, as we just talked just a minute ago. Okay, so your take-home message, certain dietary supplements can reduce LDL cholesterol, improve other cardiovascular risk factors, and improve efficacy of prescribed medications. But there are no outcome studies that have shown prevention of cardiovascular disease, death, or outcomes such as disease morbidity with nutraceuticals, except red yeast rice. And that was in patients who'd had a previous heart attack. And there's only one study with the 5,000 patients. Supplements are not a replacement for healthy diet and lifestyle. And patients and provider discussions must lead to make informed decisions regarding quality, safety, and efficacy of dietary supplements. thank you for your attention. And I want to acknowledge my colleague, Tracy. She let me borrow some of her slides for this presentation. And these are my references. There's 6 on this slide, and there's another 5 on this slide, and there's another 3 on this. I especially want to draw your attention to this number 2 reference, which is Dr. Malik Dineen. We just published a book. I don't know if you can see if I hold it up. It's called ASPC, or American Society for Preventive Cardiology, Manual of Preventive Cardiology. And there's a whole chapter devoted to dietary supplements. It's called Integrative Approaches for Cardiovascular Disease Prevention. And it's edited by Drs. Wong, Amsterdam, and Peter Toth. And we all know these names. And I personally wrote the chapter on dietary strategies, which is also in this book. So just wanted to put a plug for this book. So thank you very much. And I'm ready now, Andrea, to take questions.
Thank you so much. That was great information. And I know I learned a lot, and I think I have a lot of questions as well as the audience. So while we are getting the last minute questions in, please put all of your questions in the Q&A, and Mandy is going to read those out. I just want to give everyone a chance to take the post presentation poll. And the same question, does CoQ10 improve blood sugar regulation? And I bet you everybody knows the answer. It's all flying in and everybody's got it right. And we are going to give you just one more second. But while we're doing that, I know I have a question, and I'm just going to ask it now while everybody is doing their poll. Matcha, which is a refined green tea, would that be considered an extract, or is that actually just green tea, just in a different form? Or do you know?
Good question, because I know a lot of people buy that matcha green tea and like to drink it. No, it won't have quite the punch packed in it to give you the benefit of your green tea extract.
Okay, so it's more just for feeling good. Okay, great, thank you. So we're sharing the poll results now, and 95% of you said no, so that was great. We learned a lot, I think, during this session. And I'm going to stop sharing that. And Mandy, while you read the first question, I would just like to do the final poll while we start the Q&A. So go ahead, Mandy.
Okay. So Dr. Sikand, Robert asks, can you please discuss K2 and is it natto, or it's natto, not NATO? And also, is natto high in sodium?
Very good question. Yeah, natto is vitamin K, is rich in vitamin K2, and it improves arterial health is what it's for. So it can be used, but again, read the label and make sure that the sodium content can be integrated into your overall sodium allowance if you're going to use it.
Should I keep going, Andrea, or do you want to go to the?
No, go ahead.
Okay. Elaine asks about red yeast rice, which I actually, to clarify when you start your answer, could you just explain what it is, whether it's actually a real rice or if it's a supplement you buy in a store, in a supplement store. But Elaine asks, am I correct in understanding that red yeast rice available in the US is low concentration, so less effective than products available in other countries?
Again, very good question. And it seems the questioner is very well informed, because that is true. In Europe, the concentration of monocolin K, which is the compound that works behind the scenes in red yeast rice, is fully, at the dose that is recommended. But in the US, it is not available at this time. So it can vary. There's no requirement. But in Europe, it is standardized that if they're going to sell it, they have to put the right dose that is recommended. So again, great question. And
So-
it is not just red yeast rice, but it is the extract because it's very concentrated. So it has to be in a supplement.
Okay, thank you. Could you speak to lovastatin and red yeast rice association?
Very good. Yeah, another great questions. So lovastatin, what lovastatin has is also what's found in red yeast rice. So it's very comparable. So what happens is people who get muscle pain from lovastatin, they may also get it from red yeast rice because it's a very similar compound that's in both. So they're like cousins, you could say.
Right, we've got a bunch more, lots of questions. Could you talk about the effect of olive oil on cholesterol levels?
Great question. So olive oil is what we consider a heart-healthy oil. It is high in monounsaturated fatty acids, and it's also high in an antioxidant, which is squalene, which is an anti-inflammatory. And so the studies that have been done have shown, for example, the PREDIMED study, that people who consume olive oil or nuts or both, which are monounsaturated fats, lowered the incidence of heart disease and stroke. So very good data on olive oil and all other sources of monounsaturated fats, such as unsalted nuts.
Charlotte asks, is it safe to take CoQ10 with 80 milligrams of Lipitorif if one has had a heart attack? That's very
I think I'll refer that question to their provider,
right.
Because that's a patient provider question.
Sounds good. Could you discuss flaxseed oil and its benefits?
Mm-hmm. So flaxseed oil is a very good source of omega-3 fatty acids, which is what we call not EPA or DHA, but we call that alpha-linolenic acid. And so people who don't eat fish, for them, it is good to include flaxseed oil in their heart-healthy diet. But everybody can include it. I mean, it's not just for the non-pescatarians, but definitely we recommend it as a rich source of omega-3, plant-based omega-3 fatty acids.
Okay. What does an antioxidant do if it doesn't lower blood sugar?
Okay, so antioxidant is a very generic term. You can call any thing an antioxidant. Like I mentioned earlier, CoQ10 is an antioxidant, right? Okay, so its job is not to lower blood sugar. Insulin lowers blood sugar. So it's like an oxymoron to say that antioxidant could lower blood sugar.
Carolyn asks, since supplements can vary significantly from manufacturer to manufacturer, how can one choose a safe and efficacious one? Which is a great question. How do you know where to go?
Yeah, I think that's where your provider comes into the picture, your doctor, your nurse practitioner, your PA, your dietitian. You really need to talk to them and then make a decision, a very informed decision, as we call it.
Okay. What about magnesium as a supplement? Are you familiar with Carolyn Dean, her book called Magnesium Miracle in heart attack patients?
I'm not familiar with the book, but yes, magnesium is a cofactor and can be helpful for patients with heart disease. Yes, there are some good studies on magnesium. Yes. So you can have your magnesium levels checked and see if you are a candidate for that.
Does beetroot juice effective in treating HTN? I'm not sure.
Again, sorry, I didn't understand.
Yeah, he asks, does beetroot juice, is it effective for HTN, which I don't know what HTN is.
Hypertension, high blood pressure, yeah. Okay, so good question. And yes, beetroot juice is a very rich source of polyphenols, which are even better than antioxidants, flavonoids. And it's very good for your heart health, arterial health. And there may be some studies, I can't think of one at the very top of my head that may show it may have helped with high blood pressure, but I think their bigger job is arterial health. That's what I say for all the flavonoids, all your colorful vegetables, all your colorful fruits. That's where they're a great hero for us, for heart health, arterial health.
And Robin doesn't have a question, but he compliments you on all the great information. And yes, Robin, the slides and a link to the presentation will be on our website very soon. So I'm glad you're enjoying it. I don't know if you can answer this, but what type of fish oil is best? Is that a specific doctor question?
Again, great question. If it is a prescription because you have high triglycerides, you're already on a statin, then your provider needs to help you with the prescription fish oil. But if you want to take it for preventing heart disease, for primary prevention, which means you've never had a heart attack before, then you may consider the US Pharmacopoeia. They have assigned, or the Consumer's Natural Database. So there are some resources you can turn to. And remember, in one of my slides, I gave the link to the FDA website. So go there and get some great answers there. They have a separate link for facts, frequently asked questions. And this is one of them in there. So I'll turn you to the FDA website.
Thank you. How does the cholesterol you eat versus what your body produces impact your measurements, especially on high-fat diets?
Wow, great questions. So dietary cholesterol, they've done studies and they found that it has a modest impact on your bad cholesterol or LDL cholesterol. And the modest impact is that for every 100 milligrams of dietary cholesterol you consume, you'll get about 2 milligram increase in your LDL cholesterol, right? But then there are hyper responders and hypo responders. So some people have a genetic tendency to absorb more and others have less. So there is that variability as well. So right now, if you're not eating a high saturated fat diet, which means you are following an evidence-based heart healthy dietary pattern, such as the DASH dietary pattern, the Mediterranean, or the healthy plant-based dietary pattern, then you would be, and you had 1 egg a day, let's say, then there are some studies that show that 1 egg a day will not be harmful to your intake and to your heart disease. But if you're having this problem with being a hyper responder, then you would be. So again, this is a conversation with your dietitian, with your doctor, with your nurse practitioner, with your PA, whoever your providers are, to come up with a decision on that as well. Great question.
Okay, got 2 more questions left so far. Does CoQ10 reduce muscle aches with other lipid-lowering agents, as in a PCSK9 or prescription grade omega-3 acids?
The study I looked at, they didn't include those. They only looked at statin myalgia. In fact, there was a new study that was just published in the British Medical Journal this year, 2021. But again, it was a 1-year study, 151 patients who were thinking of stopping the statin, or they had already stopped it. And what they did is they told the ones who were thinking of stopping it to stop it. And they put all 151 of them on 2 months on the CoQ10 and 2 months on statin and 2 months on a placebo. And guess what? At the end of 1 year, which means they'd done 6 rounds of both, they found that only 18 of them dropped out because of muscle pain. And in the placebo group, 13 dropped. And this was not significantly different. So we know for statin takers, CoQ10 will help, but not for necessarily. I don't have the data on that.
Could you repeat the name of the resource that you mentioned at the beginning regarding botanicals?
Sure. Let me just go back to my slides because I have a couple of good resources that I want to share with the audience. Yeah, this one. On the bottom, there is a website for FDA, and that will give you all the answers. And here are the ones that will tell you if there are contaminants. So if the supplement has this sign, USP, as you can see in my slide here. Yeah. Or NSF International or consumerlab.com. These are the three seals of approval that you can look for in terms of independent testing they have done to ensure the supplement is properly manufactured and contains the ingredients listed on the label and does not contain contaminants. So this is a very important slide for you.
Thank you. Just one more question so far. What role does your coronary calcium score play with an integrative approach to prevention?
So, just yesterday we had a patient in our clinic at the UC Irvine Preventive Cardiology Clinic, and her LDLs were 157, and she had a very severe reaction to statins, where she had the rhabdomyolysis, the worst thing that could happen to someone. And it's very, very rare. So she was a rare patient. And so in her case, to even consider a statin would be very difficult. But to think of what could calcium score do for us, once we know her calcium score, that it's showing that her arteries are already showing hardening of the arteries from the calcium score number, then it would reinforce how important lifestyle changes are to the patient and to the provider.
I think that's all the questions for now, Andrea.
Great, thank you. Thank you all so much for joining. Before we end the presentation, I want to let everyone know as a reminder, and maybe I didn't tell you in the beginning, in the chat box area, there are 2 links to the handouts that we have to go along with this presentation. You can click on those links and it will follow to the website where you can download the PDF and you can read it. They're great handouts with lots of more information for you. And I also want to thank everyone for being a part of this series. It's been a 6-part series. If you missed any of them, they are all cataloged on YouTube and on our website. Some great handouts that have been along the way have been presented, and they're all also on our website. And I want to personally and as an organization thank our sponsors of this activity, which have been Amgen, Esperion, and Novartis. We have been so thankful for their support and partnership in this program. Mandy, was there one more question that I just saw pop up? And if so, do we need to answer it, or is that something?
There were 2 more questions from Laura. I didn't want to interrupt, Andrea. So Laura asks, she just says, what score of calcium? So I'm not sure the context. What score of calcium? And then what level of calcium in the bloodstream is too high, or Ca in the bloodstream is too high?
Okay, good question. So let me take the second one first. So the level of calcium in the blood has nothing to do with your artery health. That if your calcium levels are higher than normal, that has to do with your parathyroid gland. And again, that's between you and your provider to talk about. Now, as far as scores, they go with who's at the 75th percentile and who's at the 90th percentile. And based on that, there is a risk scoring. So again, wait till you get your results to make that decision. Ask your provider, are you in the 75th or in the 90th? That will determine it.
Great, thank you. So Dr. Sikand, thank you so much for joining us. We really appreciate it. For everybody watching, thank you for being here with us and spending the hour of your day. And thank you for being a part of this program. And we will have a great day. Thank you.